All this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more talk. So we will do a chit chat today, but also wanted to go over Israel's data. And I also want to share, so part of the chit chat now, 4 o'clock to make sure that we look at Israel's data once more. Again, we're going to look at this data. You make your opinion and actually comment about that as well to tell me, what do you think? Is Israel doing well or they are not doing well? What did you expect to happen and it didn't happen that way? Or what did they say will happen and it didn't happen that way? Or if it did happen that way? Uh, a, a good, reasonable civil discussion instead of just mudslinging. So I think that will be useful. So let's start. So once again, drbeen.com. We have CMEs and CEs and all of these, not all, but a majority of the lectures that we do on YouTube end up here. Um, so with this, let's start. What I'm interested in sharing and seeing with you, and I had been looking at this data today, what my interest is to understand, number one, people who are vaccinated, what is their severe disease rate, hospitalization rate, death rate, considering that the absolute numbers will be more for vaccinated because more people are vaccinated compared to unvaccinated. And more people who are vaccinated also have more comorbidities as well, advanced age as well. So it is possible to find more numbers in them. But that is my thinking. You may think it differently, and that is fine. Let's look at these. Plus, I want to see what is the death rate in vaccinated. And then, because there has been a discussion of the fourth booster shot, although I haven't seen that happening, so that may have been a rumor or that may have been something still being speculated, thought about. So I want to see what is the result of the third booster and how is that helping or hurting or not helping, not hurting, not helping the severe disease and deaths. So let's do it. And Westfield, thank you very much. Okay, so I want to make sure that the screen is showing the data. This is Google Translate, so the translation may be off here and there. Starting from here, severely ill. Severely ill immunization. So they have, the data here shows per 100,000 inhabitants, severely ill active, severe patients new. So you can look at that data in whichever way you like. I would like to take what they have done by default, and that is severely ill active patients and per 100,000. The reason for per 100,000 is in many age groups, higher age groups, there are most of the people vaccinated and less or fewer people are there who are not vaccinated. So how do you then compare? You create some way of creating the incidence or seeing per 100% or per thousand or per 100,000. So here they have done per 100,000 uh, number calculation. So this is rate. Rate can be compared to each other. What that means is they're saying that if you have 100,000 unvaccinated people, 100,000 vaccinated people, then what is the chances of the severe disease in them? So I'm gonna hover my mouse here. If I go too much to the side, then the pop-up goes to the left side. So I'm gonna bring it here. So let's say here, this is 22nd of September. Unvaccinated 176.6 per 100,000. Immunized without a booster 40.4 per 100,000. This is 22nd September. Today is 27th September. So I'll move it to the right in a second. And then immunized with the booster 4.4 per 100,000. So if I compare with booster to unvaccinated, that is almost, so if it is 10, that will be 40. 80 is 20, and 160 is 40. So about 40 times difference. So if I go to the right side, I wish I could read this. Let me, I always have to play with this one. I'm assuming it is, oh, it moves. 176 in unvaccinated. This is 25th. 35 with vaccination, and 4 vaccination plus booster. So 26 may be 170, 32, and 3. And probably 27 data is not there yet. So 26 is, I have to play with this. I'm so sorry. 170, 32, and 3. So 170 folks who are unvaccinated per 100,000 is the rate. People with vaccination, 32 per 100,000 is the rate. And with booster, 3 per 100,000 is the rate. If you see here on this graph, this is the active patients, and once again per 100,000 active patient. You could do seriously ill as well. So if you see here with age groups, so if I go here to this age group, this is 90 plus. Unvaccinated patients, not severe patient, just cases, 943 per 100,000. Vaccinated, 480 per 100,000. So almost 50%. Immunized with booster, 174. So if you take 174 to 943, about 4 point some times, about 5 times difference. If I then take, so we can see the other age groups as well. Let's go down to a, come on. So as you can tell, so let's do this. 50 to 59 years of age cases, or active patients, sorry, I keep calling it cases. 50 to 59, unvaccinated, 1130 per 100,000, immunized 453, about lesser than 50%, and with booster 62. If I go here and I say seriously ill per 100,000, so rate, and then we look at various age groups. So let's start from here. Younger side, you can already see that almost, so 16 to 19, unvaccinated 1.4 per 100,000, and immunized and without booster or with booster, none. But I also do not know if they are actually giving vaccine at this level. So maybe the data is just not, I don't know about the data. So let's see here. 90. So this is seriously ill, 90 years and plus. Unvaccinated, 215, I believe. Come on, 215 per 100,000. Immunized without a booster, 38. And I think with booster is 14 actually. So 38, 14, and 215. So 215 unvaccinated, 38 with vaccine without booster, and 14 with booster, 90 plus, 100,000 is the rate for serious cases. So interesting to compare with booster 14 per 100,000 and unvaccinated 200 something, 210, 215 per 100,000. So that would also be 140 will be 10 times. And then another 70 is 5 times. So about 15 times difference. So this is age 80 to 89. Serious ill, active. Unvaccinated 175, immunized without a booster 52, immunized with a booster 6.8. So good results here. Look at this, 70 to 79, immunized with booster 4 per 100,000, unvaccinated 178 per 100,000. Okay, so I'm going to go to death rates. This is also an interesting chart. This chart shows for various age groups what is the percentage which is not vaccinated, two dose vaccinated, three dose vaccinated. So if you see here, dose 1, 83%, dose 2, 79.9%, and three doses, 66.9%. So for various age groups, you can see that they have three doses too. And you can see that over here, I think three doses are actually doing very well. From this data, I don't see a need for a fourth dose. But again, that is my opinion. Maybe I'm missing something. I'm going to go down here. So morbidity from abroad. So that is travelers. This is recovery and death. So let's see here. Died daily with their immunization status. So again, not immunized, two dose immunized, three dose immunized. So I'm gonna try to be here, but as you can tell, I cannot really read it very well. I'm playing with it. 21 something. So 3.5 and 0 and 1. That is on 25th. Actually, not 1, 0.1. 3.5 in unvaccinated, 0 in two dose vaccinated, 0.1 with a booster. So these look like outliers. So this is death. For example, Friday 24th, unvaccinated. And again, I believe, let's look at the parameters here. This is over the age of 60, and this is for last month. And I don't think this is so this is per 100,000. So this is a rate as well per 100,000 over 60 and last month. So if we go here, and by last month, I think that includes this because, for example, look at this number. This is Friday, 24th September. That is this month. So I think what they mean is from today back 30 days or something like that. So 24/9, unvaccinated 7.1 deaths per 100,000. Vaccinated 2.2 deaths per 100,000. And with boosters, 0 deaths per 100,000. Here on 23rd September, unvaccinated 7.1 deaths per 100,000, immunized without impulse, so without booster 2.2 and with booster 0. So you can see the trend here. There was a trend, there was a bigger number here, 12.2 on Monday, 13th September, 12.2 in unvaccinated, 1.4 in fully vaccinated, two dose vaccinated, and 0.2 in three dose vaccinated. And you're seeing the trend has actually changed. I wish I could read these numbers. I can a little bit. 2.1, 0.4, and 0. Okay, so 26th, 2.1 in unvaccinated, 0.4, I believe, in vaccinated, and then 0 in three dose vaccinated. So that is the death rate per 100,000. If I go to age up till 60, then so this is 60 and below. And if you see this, actually, let's go here. 21st September, not vaccinated, 0. Immunized with two doses, 0.1. Without that, 0. So again, it actually, somebody who is under 60 got immunized, they may have some comorbidities as well. These numbers are tiny enough. Not vaccinated, 0. Without booster, 0. With booster, 0.1. So again, that there may be other comorbidities which make a person even more vulnerable, even when they have the boosters. So, interesting data here. Generally, what this tells me is either the number of the population is lesser in number, but this is again a rate. And if you see, it's actually good under 60 years of age. So, this is the data. Um, Tell me, how do you see it? This is what I can make or interpret with the Google Translate and struggling with the pop-ups. Now, let's go here and see how are you all doing. So Doug Gross says active patients in hospital. Let's see. I would consider active patients seriously ill to be in the hospital. So if I go here, active patients seriously ill, 100,000. So this one, so they have two ways to show it, per age group or per day. So this is per age group. This one is per day. So active patients seriously ill, which I would consider are in hospital, and I may be wrong, but that's what I think. And this is with their age group. And again, if you see the numbers here, bars here, so for example, 80 to 89 years of age, regardless of the date and time, 175 unvaccinated, 52.8 vaccinated, 6.8 with booster, and this is per 100,000. Here are the numbers with the day. And I would once again, severely ill, I would consider them to be hospitalized. I may be wrong. Abdur Razak is a friend of mine as well. He's saying fifth wave is coming. So I think that the waves would continue to come in until we are vaccinated or we have experienced the COVID and gotten protection. So the hopefully the damage would continue to reduce as we keep becoming protected. Plus, as the virus continues to change. So, Gunner, almost no deaths, no matter the immunization status, makes you wonder. This is under 60 years of age. And once again, what we have to make sure is that the population count is also important. Although we then take it to 100,000. So, for example, let's say you take two population groups. They're both under 60. One has a total of 10 people in it. Other one has a total of 3 million people in it. And then you count them. Out of these 10, let's say nobody got sick. You would say unvaccinated, nobody got sick, per 100,000 ratio is zero, correct? So there is the total cohort size is also important. For example, if I go here, one can do a little bit of data digging to understand how that data is. For example, here, if you look at 40 to 49, one dose 87%, two dose 81%, three dose 49%. So 87.6% of this age bracket have one or two doses, or two doses 81.9%. So what is left is, let's say, 20%. Now, whatever that number is, when you take and make the rate out of it, it is possible that the numbers are small, which is fine. At the end of the day, people got vaccinated and they're protected, and the remaining people are small enough in number that they also do not have a larger proportion of disease in there, but they may have disease too. Now, to see what is the disease in them, what you do is the following. You go in here and you say, instead of, for example, 100,000, you can say, give me the absolute numbers. And then you can see the numbers here. But you're correct. Healthier patients, this has been a known thing from ever. Healthier, younger patients without comorbidities have a much better chance with this COVID. This is, Kenny says, be useful to know the percentage of the jabbed population who had COVID prior to being jabbed but I guess that data might tell a story not useful for the narrative. So I totally agree that knowing somebody who had COVID and has recovered will be a very useful data point. I wish that there is a fourth thing, not just for Israel, for everywhere, to add that how many people, for example, we say for US, 44 million people got COVID. So here in Israel as well, if I go to Worldometer, I can at least have a conjecture from the, and again, if you like some other place which is better data point, I'm totally fine with that. So if I go here, it's just easy and I'm more used to looking at Worldometer. It's not something. So here, Kenny, to your point, 1.2 million, about 1.3 million cases of coronavirus. Per age bracket, it may not be available here. So that means if we go back here, then everybody who's vaccinated, you could say that there is an overlap of the vaccination with 1.3 million people. Now, are they all vaccinated, or what percentage is vaccinated? At least I do not know that data. But yes, you're correct. It would be interesting to see that. I heard it said in a congressional hearing that natural immunity was only effective against the wild type strain, not the Delta strain. Is this true? I would not think so. I would think that natural immunity would help with so far all variants that we have. That is why the vaccines are also not changed, because they continue to be efficacious. So if a vaccine can continue to be efficacious with the vaccine that was built for original Wuhan version or wild type, that should be the same behavior for our body as well. So I do not know exactly the statement that was made, but I'm just responding to what you have written here. Doug says Dr. Bean has a flower on his head. So, Doug, this over there, I'll tell you a story. It is actually a funny story. So, these are cards, playing cards. But I actually, of course, nowadays it is pandemic, so nobody's here to play cards with me. The story is this, that there was a senator or someone, I forgot her name. She had made a statement. Her statement was that, I don't know what she was talking about, that the nurses' pay does not need to be increased because most of the time they are free and they are playing cards. And she created um, quite a mess with that statement. And then she said, "Well, I'm gonna." So she was offered by the nursing organizations to say, "Come see what we are doing and come see where we are playing cards." And she said that I would follow some nurses someday. I do not know if she actually did that or not. So when she said they're playing cards, I said that I'm going to start teaching playing cards to nurses so they can play better cards. So I actually did a small, I think, 2 minute skit, my acting or overacting. So in this channel, there is a video of mine with a fawn, and I'm talking with someone to say, "Hey, we need to offer, playing card lessons to nurses." So that was the flower that was sitting there. And Gregory says, "I remember that card statement." Yes, that was just such a tone deaf statement she made. Barbara says, "What, nurses playing card? No." So let me show you. I think I can find her statement. If I go here and I say, um, "Nurses play cards, Senator." Um, This is the one. Washington State Senator slammed for saying nurses play cards. So let's see. Here she is. What was her name? Um, she has said she made suggestion that nurses in smaller hospitals probably play cards for for a considerable amount of the day. Who was this great senator? The Washington State Senator considered a bill Tuesday, SHB 1155, that would provide nurses with uninterrupted meal and rest periods. Yes, I remember. It was for, hey, make sure that they are able to eat and they are able to rest. To which he said, well, they're mostly just playing cards. I actually created a fake. I mean, I said this is a Twitter account from with her name, but I said fake her name, and I started tweeting about cards as well. Do you remember this one? So this is a nurse lying down, and then others are playing cards. It was not the best. Maureen Walsh, yes, her name was Maureen Walsh. Anyways, okay, so let's answer a couple of questions and then we break for today. I would, if with your permission, I would like to sleep a little earlier today. Doug Rose says, Doug, have you seen my video? Although I'm overacting in it, but it still was funny. I went to my local store. I think I went to Target. I got this. Then I picked up my phone, put it next to my ear, and, and I acted, which it is a little cringe, but still, it was for a good cause. I tried to earn from nurses for playing cards and teaching them cards. It didn't work. Okay, this is Kyrie. This is not Luffy. Do you see that Kyrie's voice is a little more? Okay, so Dorothy Hughes says, Dr. Bean, do you trust COVID tests? How accurate do you think they are? Is Luffy out? PCR and at home. So it's night outside and Luffy is out. Um, do you trust COVID tests? How accurate do you think they are? PCR and at home. So at home tests are usually rapid tests to give you an alert. So they are probably not as sensitive and specific, but PCR tests are the best we can. I mean, with all their flaws and everything, and there are people who actually believe PCR tests are incorrect and they're not useful, and but still, that is what we have. But then antibody test in the hospitals. But remember, antibody do not become positive when the first time somebody gets the infection. So PCR is the only tool available. Rima says, in Israel a few months ago, the doc, a lady on Dr. Bean's show, said they were giving COVID recovered people one shot due to Delta concern. Has that changed? So I do not know, Rima, if they have decided for one more shot or not, or if they're giving a shot or not. But at this time, they have, as you can see from their data, they've given a lot of people the third shot. But I didn't see the fourth shot. This is a very good question. Gold Country Russ says, what is the safest vaccination for a 45-year-old male? So, this age range, under 30 years of age, the rare side effect, but a side effect in men from messenger RNA vaccines have been cardiac inflammation. Um, Above 30, actually, all vaccines, adenovirus or messenger RNA, have been fine. Sorry, so Luffy's being called back in. Is he in? Nowadays, Luffy doesn't want to come back in. So Wendy says, Dr. Bean, have you looked at Dr. Geared Vendor Bosch's articles? yes. Carla says, what do you think of Merck, Pfizer, and Roche working on antivirals? They will be released by the end of the year. Wouldn't those work like Tamiflu for influenza? So to me, it seems like I actually think that majority of the current medications that might work, they're going to take some of those and invent something new as well. At the same time, in the latest days, I've come to this realization, and not under any pressure. Somebody was saying that is because you're under pressure. Not under pressure. But think about it for a second. Look at the opposition to things like lufimectin. The amount of censorship, discrediting, dismissing, actively attacking people, including myself, who talk about it. So either we fight with all of that, or we recognize that people are going to be protected by a similar drug. And if it comes from these bigger giants, nobody's going to be against it. So I never thought I'll come to this kind of realization, but the amount of, um, you can see what is going on. Eric Dog says, yes, no comment should be reading into that. Yes. Um, Revolution from Mahbet says, have you looked at the new trials mechanisms behind treatment with NSE? I've done the original discussions about NSE, but haven't looked at any new studies. I was actually thinking of looking at it. This is an interesting question. Edmond her says, does a vaccinated pregnant woman need to take the booster so the baby can be born with antibodies, or will the baby still be born with antibodies to the original vaccination before pregnancy? Good question. I'll give you two parts of the answer. So if I go here, look, what we know is, so the first thing to keep in mind, baby gets IgG through placenta. So when the baby is in the mother, IgG, and baby gets IgA in the breast milk, right? So these are the two that baby can get. Now, you're saying that if mother had the infection or vaccination before 9 months, before, of course, baby's birth, that means possibly 9 months, correct? Considering full term baby. Now, before 9 months, when let's say 10 months ago, the vaccine was given, 10th month, before the birth. And this was full vaccination. That means at this time, antibodies went up. Those antibodies stay up normally 5 to 6 months, usually. It can be longer, it can be lesser. Then they wane. And if they wane, they may still be given to the baby, IgG, but it may be a very tiny amount. Now, on the other hand, somebody who got the vaccination during the pregnancy, again, you have to decide that are you comfortable with it or not. I have done a study which shows that it does not have any negative impact. But let's say you decide to have it during the pregnancy, for our discussion point, let's say 4 months before. And we did that study that showed that after the first trimester, any of the abnormalities or effect on baby reduce as the months continue to pass and baby keeps developing and maturing. The possibility of negative impact on baby reduces. The first 2 3 months, actually, the most major issues occur even before the mother even knows that she is pregnant. And most abortions or miscarriages occur at that time. Then the first quarter is sensitive because everything is being built, brain is being built, heart is being built, and so on. So here, let's say fourth month is when the baby mother got the vaccine, fully vaccinated. So two doses somewhere, and now fourth month fully. Then she would have vaccine antibodies, which baby would continue to get when he's before the birth, and then even at the time of birth, IgG will be in baby's blood. Then, of course, if mother is lactating and feeding baby the breast milk, then IgA. I wrote IgA. So this is how to see it. Again, the decision to get vaccinated is yours, your mother's, the doctors, the community, the meaning their family. That is not mine, but I can just give you data. Doug says, is Luffy still on fluvoxamine? Actually, Luffy has become much better when he is able to go out. So nowadays, you must not have heard much of his meows. Today, he did one in the beginning of the previous lecture and one near the end of it. He is, Kyrie is here as well. Uh, when he goes out and comes back, he's much more relaxed. So, not needed. But we are still giving him because doctors had continue to give it. Don't give a um, gap. But he generally is much better when he goes out. Cool. So, if you don't mind, Luffy does patrol the yard. He actually goes all over the place. So he has a apple tile in his strap, so we can actually see him on the fawn running around everywhere. So it's a pretty happy cat nowadays. So Radh E says, if blood present when removing needle, has intramuscular injection gone into a vessel? Blood's presence is not an indicator that it has gone into a blood vein or artery or not. That simply means that there is some local blood vessels that got torn. It is possible that some of it can go in there. Oh wow, that's so interesting. Carol and says Raj has less anxiety when he goes out too. He's out all night and sleeps home all day. That is so interesting. We yet do not trust Luffy with night out, but it's pretty dark and he was out and just came back. Barbara says we love his meows as he punctuates your key statements, Dr. B. That's what he does. Every time I have something important to say, he would just come in and just meow with the statement. Uh, Thrill 415 says, is it predominantly Pfizer vaccine having breakthroughs? No. All vaccines, the definition of breakthrough is very simple and interesting. That is, if somebody gets COVID symptoms after um, being vaccinated, that can happen to anyone. CDC has started counting only, I think, since May 1st. They only count vaccinated with hospitalization or vaccinated who die and not vaccinated with the cases of COVID. So, are comments being deleted to protect Doc's channel from being put in YouTube jail? I have not deleted comments for a long time, but we do have moderators, so there may be moderation going on. I might end up in YouTube jail anyways. YouTube has already given a permanent strike. Um, have you seen David Lee, MD paper on pathophysiology of acute COVID published by ERJ? No, not yet. I have seen Dr. Paul Marrick's pathophysiology. I'll look into this as well. Nikos, Nikos, these are the questions that eventually are going to get my channel blocked. So But given your family's experience with J&J, have you lost faith in its safety profile? I'm not. So we have Pfizer, Moderna, and J&J, or three in four of the family members. I have Moderna. One of my sons have Moderna. The other son has Pfizer, and wife has J&J. They're all adults. Somebody was saying, "How dare Mubin shares his family information?" One, I have requested them, asked them to say, "Can I share your information?" It is to make sure that I can assist as many as I can with our information. And the second is, I have their permission as well. They're all adults. None of them is a minor. So, having said that, uh, yeah, the J&J was the one the most worrisome with the side effects. Now, there can be a case made to say this is just, let's say, my wife who had the side effect, and not everyone would have the rare side effects. But I still feel more comfortable with Pfizer and Moderna. But I have done this discussion many times before. What um, what sex, age, and then comorbidities or race, for example, and what vaccines have been most effective in them. Cool. So comfortable if we take off now and we see each other tomorrow? There are so many questions. Um, so let's meet each other tomorrow. Yes, my bed is calling me. It was 4 o'clock that all this happened, but unfortunately, there was a person dying next door. Um, so let's meet tomorrow. Please do me a favor, like, subscribe, and share. If you don't want to do anything, just like, that helps. And if you would like to support this work, Patreon is the best because you can then continue to help even after COVID for medical students and nursing students and professionals with the similar education, but for them. You can use PayPal as well to support, and you can buy me a coffee as well if you don't like to use PayPal. Thank you very much, and I'll see you tomorrow. Bye bye.